Lumbar disc herniation, a herniated disc in the lower back. What is it? Basically, the outer part of the disc is the annulus fibrosus, a tough woven basket. The inner part is the nucleus pulposus, the shock-absorbing watery part. It's like a radial tire. It tears from the inside out, and it's usually a bit of both of those parts of the disc that herniates out, hits a nerve, causes nerve pain down the leg. So typically people say it's the worst pain they've ever felt in their life. A lot of times they'll start with some back pain where they got a tear in the disc, and then a week or two later the pain goes down the leg. And that's when the piece tears and herniates and pushes out more and hits the nerve. And it's the nerve pain that really drives people crazy. So how do we treat these? We start with oral medications, muscle relaxants, nerve medications, pain medications, anti-inflammatories. The best anti-inflammatory in the world is prednisone. A Medrol dose pack is typically how we start. If people aren't getting better from that, we may do an epidural injection, which is basically a cortisone, prednisone, steroid shot in your spine around the nerves and the herniation. Why do we do surgery? We typically do surgery if somebody has a significant neurologic deficit, real weakness in their leg or loss of bowel and bladder function, we may do surgery right away. Most people, their weakness is not that bad, and if we can manage the pain, we may be able to avoid surgery. In fact, around 70% of disc herniations are able to be treated non-operatively. And the reason why is for a couple. One is the inflammation settles down, so a lot of the pain settles down over a couple weeks. Number two is the mass may still be pushing on the nerve, but after a while, the nerve just doesn't notice it anymore. It accommodates. You know, pain is an electric signal going up to your brain that your brain perceives. And after a while, if somebody touches you over and over again, after a while, you just don't notice it because the electric signal doesn't get sent or your brain just doesn't perceive it. So the pain can go away on its own, even if the mass is still there. Sometimes the mass, the disc herniation, goes away on its own. Around 15% of the time, it can disappear on its own. But that's only about 15%, and that can take over a year to happen. About 50% of the time, the herniations can get smaller because every time your heart beats, the spinal fluid pulsates up against the disc herniation and kind of smooth it out and back it off, just like water against a rock, and make it a bit smaller. So that's how 70% of the time herniations can be treated non-operatively. How do we treat them? We do physical therapy, core stabilization exercises. Our whole app, the Back Doctor app, is available. You're welcome to check the video on lumbar rehabilitation of how to try and avoid having surgery. When it comes to surgery, fortunately, if you have to have surgery, this is generally the safest, least invasive, best surgery we have. We've done this surgery on probably more professional athletes than anybody in the world, and while there's still risks and complications and it's not a 100% outcome, it's an excellent surgery that has dramatically helped a lot of people get back to their sport and just get back to their normal everyday life. So you have two options at this point. One is if you want to contact us directly, please email us at info@watkinsspine.com. Or you can watch the videos for the treatment. One is a microscopic lumbar discectomy. Number two is the lumbar rehabilitation. Thank you.